Joining us now, Dr. Patrick Joseph, president of the National Foundation for Infectious Diseases in San Francisco. Dr. Joseph, thank you so much for joining us.
Thank you, and good morning.
Good morning. Okay, so look, a lot of people are concerned about this patient in Dallas and the fact that, he got here and when he flew in, there were no symptoms. There's a delay. This is the real concern here, is that there is a delay from the time you are exposed to the time you start to show symptoms. Doesn't that make it an extremely complex disease to handle?
It can. However, remember, all infectious diseases have that delay. That delay is called the incubation period. It's the number of days between the time of exposure until you get sick, and every infection has a delay. We are used to dealing with that in the United States.
All right, but so here's the concern. Some people have said, okay, maybe what we need to do until we get this thing under control, we can set up some protocols to screen people as they're coming into this country from West African nations. Maybe we need to ban flights, shut them down for a while, because they can get on the plane and they're fine, and we don't find out until many days later that they actually have the Ebola virus. Is that something you would support?
I would not. The fortunate thing for us in the United States is that we have scientific principles and a tremendous amount of experience in dealing with outbreaks. Ebola virus principles are not much different from those of SARS or MERS or whooping cough. SARS was the severe acute respiratory syndrome coming from Asia. We did not have to stop flights from Asia. When there was a risk, all we did was institute taking temperatures of people as they exited countries that were carrying high amounts of this virus. And it worked perfectly well.
But that wouldn't work in this case because of the long incubation process, right?
It would not identify people who are carrying the virus. One of the important things that the media does and helps the scientists is by raising the level of awareness. We want everybody to know that if they develop a high fever and have been exposed to Ebola virus, or even traveling in one of the 5 countries of West Africa, we want them to go to the hospital right away so we can institute precautions to prevent spread.
Yeah, we want them to, but there's no way that we know that they will. I mean, Dr. Joseph, and I appreciate you joining us, we've been talking about this really for the last couple of months, and we've had many doctors on, many specialists on, and they've all sort of said the same thing that you're saying right now, and here's the problem. Everything that happened with this patient in Dallas contradicts what we have been told. The hospital knew that he had been in Liberia and sent him home anyway. He did have exposures to other people. The airport in Liberia asked him if he had been exposed to patients with Ebola. He lied and said, no, I have not, and he entered the country. We were told that it was very unlikely that he would even get here, and yet he has. And that's why a lot of people are very skeptical about what they're hearing now.
And I can understand their skepticism. And the same would apply to tuberculosis and AIDS and every other disease that has a high mortality untreated. The importance of awareness is to stop people from lying. Fortunately, for all of us in the United States and the contacts of Mr. Duncan, there was no unnecessary spread because of that.
Well, we don't know that for sure, do we? I mean, we're still checking. We won't know for another 20 days.
Well, that's correct. But he developed his symptoms, and I think you and I are following the same media stories and the reports from the CDC. He developed his symptoms when he was living in that apartment with his girlfriend and those 3 other persons. The management of them would be the same whether he was misdiagnosed or not.
We've got this new case this morning that involves an NBC cameraman. He's an American, okay? He's been in Liberia covering the situation. Or is it Sierra Leone? But he's been in Western African countries covering the situation there. All of a sudden, he develops these symptoms, and he's being flown back to the country. Now, one presumes that an American cameraman who is in that country has been educated about the fact that you don't get in a situation where you're going to exchange fluids with people who are infected. And yet, he became infected. So, what does that tell us? I mean, does that concern you at all?
Well, I think intelligent concern is always an important guideline here. We have to be cautious about presuming anything. The details of this photojournalist and how he was exposed are not yet released to the public. It would be unfair to our public and your listeners to discuss something that we don't know yet.
Okay, well, we do know that this particular virus does mutate at a pretty astonishing rate. Is it possible? People are saying, look, what if it becomes airborne? Is that something that you're concerned about? Is that something that theoretically could happen?
It has not yet happened yet with any virus that is related to the Ebola virus. To become airborne, to live in dry air, such as a tuberculosis or measles or a germ like that, would be very uncommon for a virus of this group. If it occurs, we have the infrastructure to address it, but none of us are expecting that type of a mutation.
Okay, and then finally, if I could, what you know this virus, you know our policies in America, you know what could potentially happen here. What concerns you most right now?
Hysteria. What concerns me is that when people panic, they make mistakes, and we need to rely on you and others in your field to relay the truth, to keep the awareness level high, and not to talk about an extremely unlikely situation that creates fear. If we get panic, we have a problem.
Well, I just have to stop you there for a minute. And I appreciate what you're saying, and I understand what you're saying. But I think that most people get a little skeptical, and when they hear, it's unlikely this will happen, well, it was unlikely, according to the president, that it was going to get here. And it got here, and we're finding out that sometimes the information that we're getting is not up to date. And we're not getting the straight stuff here. And I think that's what causes people to be suspicious. I mean, how do we address that problem so that people can have confidence that what you are saying is true? I do not want to create hysteria, but I also I sort of share the concern that we don't feel like we're getting the straight stuff from the officials who know the situation the best.
Well, concern is important. We should always be concerned. But we have to apply scientific principles that have worked for us in the past, and we don't have an epidemic that we haven't been able to conquer.
Well, okay, that suggests that we will need to conquer this one here on our shores. I mean, again, understand something. A month ago, when we talked to other doctors, they said it's very unlikely that there will be a patient in America. Were they just wrong?
It depends on how that was addressed. I think it's likely that we will see more patients in America. The risk of acquiring this disease in America is different. So there is a travel-associated disease as opposed to one that is acquired in the United States. So far, we have no one who has acquired Ebola virus in the United States.
Do you think we will?
And we probably will. And yet, at the same time, we're instituting the quarantine measures that are being done in Dallas so that there's no secondary cases.
All right.
That's the effectiveness of the United States infrastructure.
All right, we're going to leave it right there. Dr. Patrick Joseph, we greatly appreciate you joining us to help us sort out fact from fiction.
Thank you. And